Hello, everyone, and welcome to another episode of Mainly Animals on LRTV. I'm your host, Bobby Silcott, and as you can see, we're back in the studio today, and we have a guest that lives not too far from here, Dr. Christine Gerardi.
Yes.
And Dr. Gerardi is employed up at Bridgeton Veterinary Hospital.
Correct, yep.
Yeah, and it's only right up the road here. We'll definitely talk about that a little bit more, but
Yeah.
Thank you very much for joining us today.
Thank you for having me.
Oh, yeah. So I guess we could start maybe at the beginning.
Yep.
I was looking at your profile and the narrative on the website
Yeah.
of Bridgeton Veterinary Hospital.
Yeah.
And you have a little bit of an interesting story that's brought you to this point.
Yep.
Grew up on Long Island, New York.
Correct.
And could maybe tell us a little bit about that? And
Yeah,
there's
definitely.
a vast difference between Long Island, New York, obviously, and Bridgeton, Maine.
I completely agree with you.
Yeah, so
So I grew up on Long Island. I am a twin, so I have a twin sister, and I have another sister that's 18 months older than me. My dad's a doctor, my mom's a nurse, so I came from a very medicine-heavy science family. Even when I was a little kid, I always said, this city life's not meant for me. I knew I would eventually leave the New York area, but the rest of my family, they're still in New York, New Jersey, so I still go down and visit them. But it's very different. I think Maine is absolutely beautiful. I lived in a lot of places in the United States. So I lived in New York. I went to school in Virginia. I worked as a vet in Virginia as well. I was in Charlotte, Asheville, North Carolina for a little bit, Florida, Oklahoma. So I've been around.
And that's part of the schooling and education?
Yeah, pretty much. It was pretty much schooling, jobs that have kind of moved me around. So Maine is the place I decided to kind of just plant my roots at, and I'm really happy with the decision.
Yeah, and I noticed also the narrative said that you went to Grenada for...
Yes, I went to Grenada, so St. George's, I went there for vet school. So I went to James Madison University for my undergrad, which is in Virginia. Then I went to St. George's veterinary school. So my dad's partner went to St. George's for medical school, so that's how I found out about the program. And it's amazing. I really can't say enough great things about St. George's. It's a U.S. accredited school, so there's no need to do additional testing once you come into the States. You come right in like you would if you went to a U.S. school. And we had really great relationships with our professors. So a lot of the professors there, I would say, some of them are really big names. Like they wrote the anatomy books, like Dr. Pasquini, and people that are kind of in their time of wanting to retire, but they still want to teach. And they're your neighbors, and then they're also your teachers. So you really get to have a really nice, unique relationship with them. And it was awesome. You know, your classmates are your family when you're there. So there's no one to really, I can't go home and go hang out with my friends or my family. So you really lean on each other much more than you would in other situations. And we became really close. I still talk to a ton of my classmates today.
And so that sounds like it was personally and professionally that really
amazing.
Made that, how much that, yeah, that's great.
It really builds you. It's also just interesting putting yourself in a situation, especially coming from Long Island, where you have everything at your fingertips about 10-minute drive away from your house. Uber didn't exist back then, but stuff like that. And then you go to Grenada and you don't have a Target, a Starbucks, shopping is really, really different there. Taxing and just having to manage everything was a change. So.
Yeah, well, I went online, unfortunately, as I say, it's great, we can get online and look around.
Yeah.
The area looked just stunning.
Yeah, it's beautiful.
Where the university is.
Yep.
And you said being accredited, it sounds like they're sort of an elite school in the world. They're accredited by the United States and then Canada, was it?
So so you can practice in the United States and Canada. So it's really a great program.
Yeah.
And the veterinary school is quite small in comparison to the medical school. The medical school is quite massive there. And it's the same situation with the medical school, that it's a seamless entry into the U.S. Excuse me, do you need attention?
Marley. Yeah, by the way, let's introduce Marley. You want to talk about Marley? You brought one of your family members.
So I have 4 dogs and a cat, and all of them are rescues, and that's really how our house is. It's kind of open to something if it needs a placement and it fits in with the crew. Although my husband has asked me to stop at 4 dogs right now, which I think is appropriate. But yeah, they've all come in for different reasons. So Marley is the most recent rescue. Marley's been with us, I think maybe like 8 months now. But we joke that all of my dogs and cats tend to like my husband more. And I really wanted to get a dog that would be like my best friend. So when Marley came into the house, I was like, you're gonna start coming to work with me and you're gonna be mommy's sidekick. So Marley tends to hang out with me most of the time, trying to win him over. I still don't think I did though.
Yeah. So you'll tell us a little bit about the other dogs, what types of dogs they are, their names?
So the oldest is Guinness. She is a Pomeranian Pekingese, and she's actually from Grenada. So I got her, I think in my first or second semester while I was there, from the island. And
Was she a stray that was?
One of my classmates actually had a litter of dogs and was looking for people to take them. And she was a tiny, tiny little thing. And she was great. She was an excellent dog. She went to a lot of my labs with us because you would need animals to practice on, whether you're doing blood draws or things like that. So Guinness became the poke and prod dog of the class. So Guinness was almost like the mascot of our my vet school class. Yeah. And a couple of people got dogs while we were there. I think Guinness may be one of the few that's actually still with us. So she's getting up there. She's about 15 to 16 years in age. But she's doing great. She's my number one. Then we got Preston, is a terrier mix. We got him when we were living in Virginia. He was found in Baltimore, roaming the streets. Oh, and Stout. Stout's our cat. So I'll go. So Preston, they all came named besides Guinness and Stout. So I do enjoy a lager. So it's just funny that I do name them after the beers I tend to drink. But Preston was a rescue. We knew we weren't going to be able to rehome him, so we fell in love with him, so he kind of just fit in, so we kept him. Frankie is a golden doodle who at 4 weeks of age was going to get euthanized. It seemed like she might have had hydrocephalus, so swelling of the brain. She appeared like she might be blind. She had an overbite issue, and she wasn't walking. So instead of euthanizing her, we decided to take her in and rehab her. And now she is a fully functioning dog, but she has her abnormalities. She has form limb problems. She'll probably end up in a wheelchair at some point. She does have a bite issue that we have to stay on top of her dentistry pretty good. But she's the happiest dog ever, so that's great. And Marley and Frankie are quite best friends. And then Stout is our cat that came in that got bit by something outside, was neuro for first 2 weeks. The owners weren't able to care for him, so we ended up taking him in, planning on rehoming him, but we just fell in love with him, so we ended up keeping him as well. But yeah, Marley was our recent addition. Someone recently added a baby to their house, and they just didn't have the ability to take care of the child and Marley. So Marley came to live with us. I think that he was named after Bob Marley. I know it's not the comedian because they are not from Maine, the owners. I don't think they're familiar with Bob Marley, the comedian, although I absolutely love him. But I think it probably was named after the musician.
Oh, yeah.
Yeah.
Yeah. So maybe the other dogs, I don't know, there's a relationship. Are you able to give the dogs their shots and are you able to? So maybe that's why the other dogs are like, oh, here comes mom.
Yeah,
she's the one that gives us the shot.
Yeah.
And maybe dad takes advantage. Or dad's there to comfort them.
I think dad's there to comfort them. Yeah. Dad also breaks the rules and gives treats and shares human food, which I do not. I'm a very, very strict mommy, I say. Yes. So I don't believe in treats. I don't believe in sharing people food with your dog. So he breaks the rules, and I think he wins them over that way. So I'm the tough one. And yes, I do all the medical care too, so.
Yeah, probably no different than a human child where they'll maybe pit one against the other, so to speak, and use that maybe to their advantage. Huh?
Yeah.
Yeah, that's right. So you land here in Bridgeton, Maine, and
yes.
Dr. Wheeler and the staff up there, I just have great respect for them and what they've done. Dr. Wheeler, the business he's built there, and the staff that's there. And
unbelievable.
the longevity of the staff there. Anything you'd like to say about the folks you work with? And
I absolutely love the team. The way I actually found out about the job opening at Bridgeton was because I used to board my dogs there. So I trusted them with my babies, and every time we came in there, everyone was just very professional and also just really nice. It kind of felt like home when you were there. So my husband saw that they posted the job opening on Facebook, and then I ended up applying. And getting to work with the staff has been amazing. I cannot say enough wonderful things about Dr. Wheeler. He's probably the best boss I've ever had. And he's a great mentor. He is really open to any ideas or any changes I would want to make. He's really great about that. So every Tuesday and Thursday morning, him and I kind of meet for coffee for about like 10, 15 minutes before we start our day, just to touch base on everything that's going on, talk about difficult cases, talk about things that we just need to work on. It's a really nice relationship. And the staff that's there, I mean, they've been there for years and some people decades, and I think that talks volumes when people want to stay someplace. And I think it also helps the clients as well, because they come in and they recognize everyone, or they call in and it's, hey Leah, how's it going? It's really nice. It just makes a difference. Every single day I go to work, I love my job. And yes, I enjoy being a veterinarian, but there's a ton of stresses that come along with this field that I think some people just don't appreciate. So to be able to leave every single day with like a smile, I mean, I truly, truly love my job, is awesome.
Yeah, so you're actually bonding as friends and live in the area. Most of them probably live in the area.
Yep.
And again, I was on the website this morning. Several of the faces and names I recognize there, and then of course Leah, it's been there for so long, and some of the things that she's done, not just only. Again, personally and professionally, she's really, I have a lot of respect for Leah and what she does and her ability to do what she does.
Yeah.
So it's not only the bond with the human clients you're talking about, the pets, I imagine that means a lot to them when they come in.
Oh, it does.
And they're comforted by
It does.
a familiar face.
Oh, definitely, because every pet needs to be handled differently. And walking into the room and knowing, okay, I can't be really loud. I have to be in my softer voice. Or walk in and don't look at the pet. You just want to talk to the owners, and then they're going to get comfortable. If you know they need to have treats, if you have to be on the ground with them versus they're better on the table, they're better with their owner or away from their owner. So it's much easier once you figure out how to work with the patient. And then every single time you come in, it just makes the appointment better for them. Sometimes you have puppies that you can tell are going to struggle with coming to the vet office, or just they're not as socialized as you would want to see. So we offer people to do happy puppy visits. And so come by at your convenience and just let us walk your dog around the building and just have them come in and not be poked or prodded or get a temperature taken. And when people do take advantage of that, it's amazing to see when a dog goes from almost trying to bite you out of fear to like wagging their tail and super happy to come in. So it's a really nice thing to be able to offer. And the staff just really welcomes it.
And there's a wide range of services that
yes.
you want to talk about?
Oh, yes. So I think our clinic is quite unique in Maine based off of the dentistry that we offer. So we definitely do, preventative care. That's our huge thing, but also it's advanced dentistry, which is something that's really quite unique to Bridgeton Vet. So typically at veterinary hospitals, you're able to do teeth cleaning, and if a tooth needs to be extracted, I would say majority of vets are comfortable with doing that. But at our facility, we're trying to save teeth and keep them. So to be able to offer root canals and just more advanced dentistry options, people really respond well to that. So we do have people that travel quite far for our dentistry options. In New York, Massachusetts, we have people come down from Canada. So it's pretty unbelievable.
Oh.
Yeah, so we do book a little bit far out. We try our best for our clients to try to squeeze them in, but it is pretty cool, the things that we can offer.
Yeah. Now, are things returning to, I guess, normalcy as far as scheduling, clients coming in? It was quite a challenge there for a while.
I mean, I think it's always going to be a challenge with scheduling, and we try our best to have there not be a huge wait time. But as far as everyone can come into the clinic, there's no restrictions on the amount of people that can come into the clinic, so it's not curbside anymore. Although if you do want curbside, we still now offer that as an option. Some people really enjoyed that, so if someone wants to do that, that is definitely offered to them. With, as far as booking appointments, myself and Dr. Wheeler are really proud to say that we are open to new clients. A lot of places during COVID, I would say almost majority of the state closed down to opening for new patients. And Bridgeton had to close for a short period as well. But since I've been there, we have been open to new clients, and we've had people come from Vermont, unfortunately, because they can't find another clinic that will take them. So I think that's really important that if you're moving to this area, that Bridgeton is open and welcome to see you.
All right.
Yeah.
So reach out if you,
Reach out.
Yeah.
Yeah.
And is there, I guess, a wide range of different animals that you folks treat there? Not only dogs and cats, or is there?
So it's primarily dogs and cats. There is some wildlife that comes in just because we have I wouldn't say a contract, but just a relationship in the area. If something is found, that we'll try our best to handle it. But I would say for the most part, we really are dogs and cats. As far as pocket pets, I wouldn't say that's my strong suit. So I do offer to try my best, but I tell people, if you're really concerned and you want more advanced care, I will refer out to other vets that I think would be a better option.
Right, yeah.
So-
Well, that's great that you're able to do that as well.
Yeah.
Because you're serving the clients and the...
Yeah, you try your best, I used to have chickens, so people sometimes will call it chicken questions, and I just go off of my knowledge from the chickens that I've had, and I try my best, but am I the best chicken vet? No.
Well, it's nice that you're willing and able just to refer them to someone who's going to do what the patient is looking
Exactly,
for. Yeah.
exactly.
Yeah, great. And I also noticed it seemed like you've got a couple specific interests in the field. Oncology
Yes.
Was one of them.
Yes.
Without getting too technical, do you want to talk a little bit about that? It seems to me as that would take some pretty intense and a passion maybe to be able to just really submerge yourself in that. It's probably somewhat complicated, I would guess.
So it's something that really developed at Oklahoma State. So I did my clinical rotations there, and I did oncology for 2 of my rotations, because I did it for 1 rotation, and I really fell in love with it, and so I just wanted to get more advanced skills. And I think it's a combination between I really enjoy the cancer component to it. I also just enjoy geriatric care as well. So a lot of times, and thankfully, majority of the patients that are dealing with cancers typically tend to be older patients. Is that true for all patients? No, unfortunately, I recently had a Maine Coon cat that was 4 years old that was diagnosed with a pretty aggressive form of cancer. So things like that are terribly sad. But it's really interesting to talk to clients about their options that they have as far as if you want to pursue chemotherapy. Radiation is not typically something we tend to offer because you'd have to go to Boston for that treatment. So I'd say chemo is the most common options that we have in the state of Maine. And really explaining to people the difference between animal chemo and human chemo. Because a lot of people have opinions of chemotherapy based off of what people go through. And it's grossly different. So in humans, we're really trying to be very aggressive because you're trying to get the cancer eliminated and not have it come back. But when you're dealing with dogs and cats, your goal is to try to get them into remission and feel good. So we're not typically trying to eliminate the cancer. If you can with a surgery, that would be ideal. But typically when you're doing chemo, you're trying to get the pet into remission and keep them in remission, but keep them comfortable. So the second that a dog or a cat is feeling sick or miserable, that's not the goal of chemotherapy. So that's when you say we need to look at different options. But it's really nice to know that it's actually a very, it's to keep your pet happy and healthy. And I think a lot of times people think if I'm going to put my dog or cat through chemo, I'm going to make them miserable for a couple of months. And it's not. It's quite the opposite.
Right. So maybe the basics of quality of life.
Yeah.
As opposed, because I guess that's it's not exclusive to them with this. My understanding is cancer is one of the biggest fatalities for dogs, particularly.
Dogs particularly,
Yeah.
especially large breed dogs. I would say you're going to see it more frequently. Purebreds are going to be up there. So anytime you have a boxer with a lump, I say take it seriously because they're cancer machines, unfortunately. Golden retrievers as well. They just are prone to it. And the sweeter the dog, it seems like the higher the chances that they're going to get those things. So just anytime you see something abnormal, reach out to your vet.
Right. It's best to do that up sooner the better, maybe.
Exactly.
Right, because like most cancers, I would imagine the sooner that you can detect that and start treating whatever it may be, the better chance.
The better chance you have.
Yeah, the more stages, I guess.
Yeah.
Does that apply to the animals as well? It's like it would
Oh,
stage 2 or 3?
definitely,
It is,
definitely.
yeah, and the progression of that.
Yes. And the unfortunate thing with cats is that cats have a prey-predator instinct built into them. So it's built that they are not supposed to show any signs of weakness. So a lot of times once you notice in cats that something seems off, it typically is usually so far progressed that it's challenging to treat. So I would say cancer in cats typically are found when they're at the end stages because they are built to never show a sign. So
That natural instinct to show strength, weaknesses.
Yep.
So it looks like nephrology is another
yes.
specialty that really interests you. And,
Yes.
Can you talk a little bit about that?
Yeah, definitely. So I actually don't even know where that all started. It probably was during vet school at some point, but I seem to just lean to those cases. And again, I think it's because it tends to be the geriatric patients that tend to present with kidney failure or some type of kidney disease. It wasn't until I moved to Maine that I actually diagnosed my first case of Lyme nephritis. So that's something that I think is more and more being diagnosed, but it wasn't something I was seeing when I was practicing in Virginia. I'm sure it probably is now, but that's a pretty devastating disease because a lot of times it seems to affect dogs like middle age, anywhere between like 5 to 7 years of age. It's a really aggressive form of Lyme disease that just causes severe kidney failure. And you have a dog that went from healthy, no issues, to they're going to pass away in about 3 to 6 months. And so just trying to make those pets as comfortable as you possibly can and to give them as much time as possible. So again, I think the kidneys are interesting, and there's just a lot of different diseases and things that can factor in. So I don't know, I've always enjoyed it. But again, I think it's really just truly that geriatric age that I tend to gravitate towards.
And what do you see in the future? You're continuing your education, or is this like practicing? Or
Yeah, so I definitely see myself staying in Bridgeton. I find this will be my forever home. I would definitely like that. And I think I'll be diving more into probably surgeries. I really have been concentrating my continuing education in more advanced soft tissue surgical procedures. So that's something I've been concentrating on this year. I also really enjoy ultrasounds. I find that to be an amazing diagnostic tool that a lot of practices can have. And we do currently offer abdominal ultrasounds and echocardiograms at our clinic. But I have a doctor that comes in to do that imaging. It is something that I would like myself one day to be able to do abdominal ultrasounds. I can do a little bit of it, and so I'll practice on patients, but it's something I definitely want to become more advanced in.
it seems if it was a simple thing, everybody would be doing it. It sounds like it takes quite a dedicated and
It does.
Yeah.
It does. It just takes repetition. So just having the ability to scan abdomen. So what I've been trying to do is for surgical patients, once they're clipped and cleaned and getting ready for surgery, try to scan their abdomen. And getting used to normal is the key. So just really seeing, what it should appear like. So, and I also do work at Kennebec Valley Humane Society on Mondays. I do surgery there for the shelter.
Augusta?
Yeah.
Yeah.
So I try to do about 2 to 3 Mondays a month, and it's just pretty much surgery there, and that's been awesome.
And they have a new facility up there. They finished up the
Yes.
capital campaign, and
Yes.
they just really were a Herculean effort.
Yeah.
And Charlie's, I believe, was one of the main sponsors
Correct.
for that.
Yes.
Yeah. So what's it like I haven't been able to get up and see the new facility, but from
It
what
is
I've seen, it looks
Amazing.
phenomenal. Yeah.
Amazing. I was there last Monday, actually, was my first time that I did surgery in the new facility, and it is a night and day difference from where we were before. And it is just going to be a great option for the community because we're going to have a clinic side where we can really offer a lot of services to the surrounding community. But it also is just going to allow us to do more with the pets. And we'll be able to even house more pets there because it's huge, it's beautiful, it's state of the art. It really is awesome. And another thing that we're going to be able to do at the shelter that we haven't been able to do in the past is offer dentistry options. So we have a wet table there now, and we'll be able to offer dental cleanings and extractions that are needed. So it's awesome. You should definitely go up and take a view. It's beautiful.
Yeah, I think that I'm going to do that here at some point. I think that's worth doing. I've been to the facility a few times.
Yeah.
I was a board member at Maine Fed for a while.
Okay.
And was able to go up in the old facility. And when they started that campaign, I think that Maine is really a shining example, at least from what I've seen, of the shelters. The faces of shelters are just changing so much. They're not just a place where they're sitting there shoveling these, moving these pets through. It's really what you talk about, just state of the art and really focusing on the care and well-being of the pets and that come through there.
Yep.
And the community involvement
Yes.
that they're able to generate is really phenomenal.
I agree with you.
Yeah.
The foster program is huge. There's, a lot of pets that are not even housed at the shelter. They're housed at people's homes because of the fosters that we have. So a lot of times people are in positions where they can't keep their pet anymore and they struggle with what to do. And I keep telling people, bring them to the shelter. Your shelter is an excellent option. I think a lot of people have the image from the commercials and they think that it's a horrible place for a pet to go. And I try to take away that stigma because it's not. Like the people that work at these facilities above and beyond love the pets that are there. And the foster program that's there too as well is really awesome. If there is a pet that does not do well in a kennel, we really try our best to get them into a house.
Right.
And the grounds that the shelter is on is you'll have to walk it in the springtime. And I do think they have a company that is going to sponsor making walking trails for all of the dogs. But I think they're on about 75 acres there. So it really is a paradise.
Wow.
Yeah.
Night and day compared to the
Night and day
previous-
difference,
yeah.
The last building was great when I don't know when it originally opened, but it's had its problems over the last couple of years. So it's just, they worked hard to get that building, they earned that building, and it's just, again, it's gonna be such a huge option for the community. Before, the shelter didn't really do vaccine clinics and things like that, and now they're gonna be able to. So it's gonna be something that's really gonna benefit a lot of people. I hope you stop by in a day that I'm doing surgery there, and you're welcome to pop on in and say hello.
Yeah, I'll try to schedule
Yeah,
around that. It's
yeah.
not all that far away, so it's just a little trip up the highway there.
Yeah.
In Maine, at least from what I've seen up here, and it's really helped, drive the idea of compassion and no-kill, low-kill shelters, and it's really the community involvement that it does. And when the community realizes what their role is in something like that, it's really changing. And the comparison, I can think of any southern state just about. I'm not dissing southern states, but it's just the way it is culturally and the community involvement. It's really not there like it is here.
Yeah. No, you're 100% correct about that. And I think one major reason is because Maine and the people here are huge on preventative care and getting their pets spayed and neutered and not having pets just wander is a really big deal. So I do think our community is a definite component as to why our shelters can be a very low kill, no kill situation. And I do think Kennebec does a great job on putting the community first, and they only take in dogs from out of state when there is a low point and they have the ability to take them in. I think sometimes people get upset that they think our shelters are getting overfilled with out of state dogs. And I really don't think that is the issue. We typically only take them in from out of state if we have an overabundance of ability to take something in. So if our numbers are just low. So we really do prioritize the community.
Yeah, and I just love that. I think that it's really, Maine is a shining example for that. I think around the state, of course, when folks, northern Maine, southern Maine, and how you differentiate that, it is a difference.
Yeah.
There's the communities and there's a lot of differences, but I think statewide there's a real emphasis on is changing the face of sheltering and rescues and so on and so forth. So that's great that they're doing that.
Yeah.
So just to shift gears a little bit, there was also some mentions on there, some of your personal interest.
Yeah.
Sounds like you take a real interest in foodie. You're kind of a foodie person. And so,
yes. And Portland is definitely the place to be trying new foods, I would say. So when I initially moved up here, I did live in Portland for a year before we ended up moving to Norway. And the Portland scene is pretty outrageous. The last restaurant I went to was 12, and it was one of the best meals I've ever had. It was really outstanding. So I really try, my husband and I were saying, once a month we should treat ourselves to a really unique restaurant, a different restaurant, a new local restaurant. We haven't been great about sticking to that, because you get busy and things come up.
Sure.
But it is something that I want to try to keep pushing. And Bridgeton is great too. I mean, there's a ton of restaurants that have, come into the area. So I love it.
And also mentioned you're a big sports fan.
I am.
I am. What's your favorite sports? What's the draw?
Yeah, so I would say I'm a big football fan. I grew up as a New York Giants fan. My husband is a Patriots fan.
I'll say in both.
So that's always interesting. His family thinks that I will convert to Patriots, and they keep buying me Patriots gear, but I will not. I will stay strong as a New York Giants fan. But I also enjoy basketball. The one team that Noah and I can probably agree on is the Celtics. Oh. So I've always cheered for the Celtics. Yeah.
So is there anything that we haven't discussed you'd like to add to this, or that you'd like to talk about, or?
I would just say, if you have a dog or a cat or any pet, and it hasn't been seen by your local veterinarian, I recommend making an appointment. Preventative care is the best way to keep your loved one with you as long as possible. And I also think a lot of times some people think, oh, my dog, my cat, it's fine. Why do I need to go to the vet? And then they wait until there's all of a sudden an emergency and you might not be able to get in. So developing a relationship with your vet team is really, really important. And also, it's much easier to pick up on differences when you see a pet every single year. And again, that preventative care, the keeping on top of their oral health, their weight is a really big issue. So it's just really important to make that relationship and stay with it from when they're a puppy until they are that senior dog. So that would be my biggest thing to people. I think sometimes they think some people are scared of the vets and what are they going to say? We're not scary people. We love talking to you and talk to you. There's a lot of times things that people can do at home for their pets that they just don't even know about. And so meeting us and letting us talk with you about nutrition, again, oral care are just things that people say, oh, I had no idea I could do that. So, give us a call. We like for people to have tools at their house so that they know how to proceed going forward. So it's all about education and just stay on top of it.
Yeah. So what would you say is the most rewarding part of this up to this point? What really gives you that feeling of accomplishment and just a self-satisfaction?
Yeah, it's an interesting career to be in because a lot of times you see your patients from when they are a puppy or kitten until the day that they pass. And so you go through so many life changes, and you develop with them and you develop with the families, and you really become attached. And so when it does come to that time to say goodbye, sometimes that is the most rewarding because they're like family members to us. And to know that, gosh, that pet really had a great life, and to be able to give them a nice, peaceful goodbye and know that the family is comfortable with the decision that they're at is really unbelievably rewarding. It's emotional, it's challenging, and it's something that takes a long time to become comfortable with. But to know that you've seen that pet go from the running around and all excited and chewing your finger because they're teething to doing their spay or neuter or doing their dental procedures, just constantly seeing them every year, dealing with their nail trims. They went from jumping around for their nail trims to all of a sudden they're that senior dog just sitting there. And just knowing that you did right by them is pretty unbelievable.
Good.
Yeah.
All right, so there you have it, folks. I want to thank you for joining us on this episode of Mainly Animals on LRTV. And I want to thank Dr. Christine Gerardi for joining us today and sharing your story and bringing Marley along.
Oh, thank you for having us.
Yeah, so maybe down the road, can have you back. You're welcome to. Education's a big part of this, and I think that was successful today. So.
Oh, thank you.
Yeah.
Thanks for having me.
Yeah, so I want to thank everyone again for joining us, and we'll see you next time on Mainly Animals on LRTV.